Hello, everyone. I'm going to be talking about vasectomy, a safe and effective permanent birth control option. And my name is Jenna Buser. So, what is vasectomy? Today, I'm going to be talking about vasectomy, which is a permanent and highly effective form of male contraception, even though it's a common procedure. There are still a lot of misconceptions about it. I'll explain how it works, how effective it is, the pros and the cons, and who it may be right for. Okay. So, how the male reproductive system works. So, for this slide, I did put a diagram so you can see how exactly like it works like in a procedure. So, sperm are produced in the testicles and travel through the tubes called the vas deferens, which is here. See it? There's an arrow. They mix with the semen and are released during ejaculation. A vasectomy blocks this pathway. So, they cut this, the vas deferens. How a vasectomy works. So, during a vasectomy, the doctor cuts or seals the vas deferens. This prevents sperm from being included in semen. It's important to know that ejaculation still happens normally. The only difference is that the semen no longer contains in the sperm. So, effectiveness. Vasectomy is more than 99% effective, making it one of the most reliable forms of birth control available. However, it does not work right away. It can take about 8 to 12 weeks for all remaining sperm to clear, as semen analysis is done afterwards to confirm effectiveness. So, the procedure. The procedure is quick and usually done in a doctor's office. Local anesthesia is used to numb the area. Many doctors use a no scalpel method, which is which involves a small puncture instead of a large incision. This often means quicker healing. So it takes about 15 to 30 minutes, performed in a doctor's office. And for recovery, most people recover quickly. Some swelling or mild pain is normal for a few days. Ice packs and rest help. Many return to work within a couple of days, but strenuous activity should be avoided for about a week. So, like example, like heavy lifting, moving in a wrong way, and it is highly recommended to ice. So, advantages. The advantages for vasectomy, one major I will include is that it is very effective. It's also permanent, which is helpful for people who are certain they do not want children. It doesn't affect hormones, mood, or sex drive. It also allows men to take responsibility for long-term contraception. So, disadvantages and risks. Vasectomy should be considered permanent. While reversals exist, they are expensive and not guaranteed to work. Like any surgery, there are small risks such as infection or bleeding. It's also important to remember that vasectomy does not protect against sexually transmitted infections, such as STIs. Common myths. There are many common myths surrounding vasectomy. It does not lower testosterone levels. It does not change masculinity. It does not affect erections or orgasms. Most men report no difference in sexual performance after recovery. Who is it right for? This option is best for people who are absolutely sure they do not want biological children in the future. Because it is permanent, it requires careful thought and decision with a healthcare provider. So in conclusion, a vasectomy is a safe and highly effective permanent birth control method. It works by preventing sperm from entering semen and does not interfere with sexual function. Anyone considering it should consult with a healthcare provider to fully understand the decision. So these are the credible sources that I use. I do recommend you guys visiting these sources and reading about it if you are considering a vasectomy or in the future or you just want to learn more about it.